I don't think you can really understand what it feels like as a parent when you get to that point where you're desperate that you're willing to, pick a drug randomly and you think about the good, the bad, and it's worth a try.
The main point of the study was to test a new idea about a unifying theory for the cause and treatment of autism that we call the cell danger hypothesis, and the role of abnormal purinergic signaling in maintaining a cellular defense state that alters neurodevelopment. Cell danger response is a universal cellular response to stress or injury that utilizes about up to 30 different biochemical pathways. The first thing to know about the cell danger response is that cells do what nations do when they go to war, is they harden their borders and don't trust their neighbors. Paper was designed to really focus on the safety and tolerability of Suramin in a small group of children, 10 boys, ages 5 to 14, all with autism spectrum disorder. We used standard outcome measures that included the Autism Diagnostic Observation Schedule, ADOS, as well as the Autism Treatment Evaluation Checklist, the ATEC, the Aberrant Behavior Checklist, ABC, and the Clinical Global Impression Scale, CGI. And each of those showed improvements in the children who had received Suramin in the core behaviors of language, social interaction, and repetitive or restricted behaviors, and none of the children who had received placebo did.
But we noticed he was a little calmer. He was a little focused, as though he's looking at you. He's noticing you're there, and what's coming out of your mouth. Primarily, his biggest issue is language. But he was looking at you when you were talking to him. Though his language did not get better, but I can notice that I could actually say something to him and I know he's looking at me. The director of the program, he go to a private school, made a comment to me and said, you know what? He is in the moment. Before she'll see him all over the hallways and he's like, he's there, but he's not there. He said he's in the moment.
So Charles can always say, I want this, I want that, but he doesn't comment about anything that's happening in his life. Even when he gets hurt, it's really rare for him to say, I'm hurting. But that later that evening when we were having dinner, he actually said, I'm done with dinner, and which was great, because normally he'd say, I did it, in this very high-pitched voice. And he was like, I ate my dinner. And we were like, wow, dinner, like, that's awesome, And you have to be a parent to understand what important word dinner is. It just emphasizes that there is an understanding there that can't get out.
When cellular resources are no longer exchanged between cells, cells stop talking, and when cells stop talking, it influences development, and you can say when cells stop talking, the children stop talking. Next step will be to ask to extend the results in a larger clinical trial, to ask the question, do a few doses of Suramin over a few months definitively improve the core symptoms of autism? So do they improve language, social interaction, and repetitive or restricted behaviors?
It shows, I think, this drug, it shows that all of these kids are capable of doing such great things, and they're sort of locked into their body, and this is a drug that can unlock that.
This is something that at least we can try more and see what's there, because it did make some difference to my child, and I want to see what else can I do for him before it's too late for him.